As we grow older, we become more mindful of our health, monitoring our heart, keeping our bones strong, and staying mentally sharp. But there's one part of the body that often gets overlooked, even though it plays a crucial role in our daily lives: our feet. Think about it. Your feet support your entire body, carrying you through every step, every journey, every experience. Yet, they are one of the most neglected parts of our health. Did you know that foot problems are among the leading causes of discomfort and mobility issues in older adults? Ignoring foot health can lead to chronic pain, infections, and even a loss of independence. Simple activities like walking to the store, climbing the stairs, or even standing for a few minutes can become difficult and painful if foot issues go untreated. But the good news is most foot problems are preventable with the right care. In this video, we'll take a deep dive into the most common foot diseases that affect seniors, what causes them, how to recognize the early warning signs, and the best ways to keep your feet healthy and strong. We'll also share expert tips on proper foot hygiene, the right type of footwear, and simple exercises that can improve circulation and reduce pain. Whether you're already experiencing discomfort or just want to stay ahead of potential issues, this information could make all the difference in maintaining your mobility, independence, and overall well-being. So stay with us until the end, because taking care of your feet isn't just about comfort. It's about ensuring you live a longer, healthier, and more active life. Let's get started. As we age, our feet undergo natural changes, losing elasticity, developing joint stiffness, and becoming more vulnerable to common health issues. But how serious is the problem? Studies show that nearly 75% of adults over the age of 65 experience some form of foot pain or disorder, ranging from bunions and corns to more severe conditions like arthritis and neuropathy. In fact, 1 in 3 seniors suffers from balance issues directly linked to foot discomfort, increasing their risk of falls, a leading cause of injury and hospitalization in older adults. Beyond discomfort, poor foot health can significantly impact mobility and independence. When foot pain becomes severe, simple activities like walking, exercising, or even standing for long periods become challenging. Over time, this inactivity can lead to muscle weakness, weight gain, and a decline in overall health. Many seniors who suffer from foot conditions tend to move less, which can further contribute to cardiovascular problems, reduced circulation, and even mental health issues like depression due to limited mobility. But here's something even more alarming. Foot health doesn't just affect how well you walk. It's directly connected to your entire body's well-being. Your feet contain thousands of nerve endings and blood vessels that help regulate circulation. If foot problems go untreated, they can lead to poor blood flow, increased risk of infections, and complications in people with conditions like diabetes and heart disease. Swelling in the feet could be a sign of kidney or liver issues, while persistent numbness could indicate nerve damage. By neglecting foot health, we may be ignoring early warning signs of serious medical conditions. This is why taking care of your feet is about more than just comfort. It's about preserving your mobility, maintaining independence, and safeguarding your overall health. In the next section, we'll explore the most common foot diseases affecting seniors, how to recognize them early, and what you can do to keep your feet in top condition. Our feet endure a lifetime of wear and tear, and as we age, they become more susceptible to various conditions that can cause pain, discomfort, and even serious health complications. Let's take a closer look at some of the most common foot diseases affecting seniors, their causes, and how to manage them effectively. Bunions. One of the most common foot problems in older adults, bunions are painful, bony bumps that develop on the joint at the base of the big toe. Over time, the big toe starts to lean toward the others, forcing the joint out of alignment. This condition can make walking difficult, cause swelling and inflammation, and lead to chronic pain if left untreated. Bunions are often caused by wearing tight or narrow shoes, arthritis, or genetic predisposition. Managing them early with proper footwear, orthotic inserts, and simple exercises can help prevent them from worsening. In severe cases, surgery may be necessary to correct the deformity. Bunions. One of the most common foot problems in older adults, bunions are painful, bony bumps that develop on the joint at the base of the big toe. Over time, the big toe starts to lean toward the others, forcing the joint out of alignment. This condition can make walking difficult, cause swelling and inflammation, and lead to chronic pain if left untreated. Bunions are often caused by wearing tight or narrow shoes, arthritis, or genetic predisposition. Managing them early with proper footwear, orthotic inserts, and simple exercises can help prevent them from worsening. In severe cases, surgery may be necessary to correct the deformity. Corns and calluses. Corns and calluses are thickened areas of skin that form due to repeated pressure or friction, usually from ill-fitting shoes or excessive walking. While they might seem harmless at first, they can become painful over time, especially if they press against nerves or underlying bones. The best way to manage corns and calluses is by wearing properly cushioned footwear, moisturizing regularly to prevent dryness, and using protective pads to reduce friction. In some cases, a podiatrist may need to remove them safely to prevent infection or further complications. Hammer toes. A hammer toe occurs when the toes joints become bent in an abnormal position, giving them a claw-like appearance. This condition often results from muscle imbalances, arthritis, or wearing tight shoes for extended periods. Hammer toes can cause pain, difficulty walking, and pressure sores if not treated properly. In mild cases, wearing shoes with a wider toe box, performing toe stretching exercises, and using orthotic devices can help realign the toes. However, in severe cases, surgery may be required to correct the deformity. Ingrown toenails. An ingrown toenail occurs when the edge of the toenail grows into the surrounding skin, causing pain, swelling, and sometimes infection. Seniors are particularly vulnerable to this condition due to changes in nail thickness and difficulty in proper nail trimming. Common causes include cutting toenails too short, wearing tight shoes, or sustaining foot injuries. If left untreated, an ingrown toenail can lead to serious infections, especially for individuals with diabetes or poor circulation. To prevent this, always trim nails straight across, wear comfortable shoes, and keep feet clean and dry. If an ingrown toenail becomes infected, professional treatment is necessary to avoid complications. Plantar fasciitis. Plantar fasciitis is a painful condition caused by inflammation of the plantar fascia, the thick band of tissue that runs along the bottom of the foot. It is one of the most common causes of heel pain in older adults and is often triggered by excessive strain on the feet, wearing unsupportive footwear, or prolonged standing. The pain is usually sharpest in the morning or after long periods of rest. To alleviate discomfort, seniors should focus on gentle stretching exercises, wearing supportive shoes, and using orthotic inserts. Applying ice packs and taking anti-inflammatory medications may also help reduce swelling and pain. These foot conditions may seem minor at first, but if ignored, they can lead to severe mobility issues, chronic pain, and an overall decline in quality of life. In the next section, we'll discuss simple yet effective foot care tips that can help prevent these problems and keep your feet in optimal health for years to come. As we age, our bodies go through countless changes, and our feet are no exception. Their decades of walking, standing, and bearing weight take their toll, making older adults more vulnerable to various foot problems. Understanding the causes and risk factors can help us take proactive steps toward better foot health. Age-related changes. One of the biggest reasons seniors experience foot issues is the natural aging process. Over time, the fat pads on the bottom of our feet begin to thin, reducing the natural cushioning that once protected our bones and joints from impact. This makes walking more uncomfortable and increases the risk of developing painful conditions like plantar fasciitis, corns, and calluses. In addition, our tendons and ligaments lose elasticity, causing stiffness and a reduced range of motion in the feet. This stiffness can lead to joint pain, hammer toes, and a higher risk of injury. Many seniors also develop arthritis in their feet, which can cause swelling, inflammation, and difficulty walking. Circulation also slows down with age, making it harder for the body to heal from minor cuts, blisters, or infections. For individuals with diabetes or cardiovascular conditions, poor circulation can be particularly dangerous, leading to slow healing wounds, infections, and even nerve damage in the feet. Another major factor is loss of balance and muscle strength. As we grow older, the small muscles in our feet and ankles weaken, making falls more likely. Studies show that 1 in 3 seniors over 65 falls each year, often due to poor foot stability or pain-related mobility issues. Lifestyle factors. Beyond aging, our lifestyle choices play a crucial role in foot health. One of the biggest culprits: improper footwear. Shoes that are too tight, too loose, or offer little support can contribute to a wide range of foot problems. High heels, narrow shoes, or shoes without arch support can lead to bunions, corns, hammer toes, and chronic foot pain. Seniors should opt for well-cushioned, properly fitted shoes to protect their feet from unnecessary stress. A sedentary lifestyle is another major risk factor. Lack of movement weakens foot muscles, reduces circulation, and increases stiffness. Regular activity, such as walking or gentle stretching, helps maintain flexibility, prevents stiffness, and promotes healthy blood flow to the feet. On the other hand, excessive standing or walking on hard surfaces without proper support can lead to overuse injuries, including heel pain and joint inflammation. Additionally, underlying health conditions such as diabetes, obesity, and poor circulation can make seniors more susceptible to foot complications. High blood sugar levels can damage nerves in the feet, leading to numbness and an increased risk of unnoticed injuries or infections. Excess body weight puts extra pressure on the feet, increasing the risk of conditions like plantar fasciitis and arthritis. By understanding these risk factors, seniors can take steps to reduce strain on their feet, make healthier footwear choices, and stay active in a safe and balanced way. In the next section, we'll explore essential foot care practices that can help prevent these common issues and keep your feet healthy for years to come. Our feet carry us through life, and as we age, taking care of them becomes more important than ever. By following a few simple but essential foot care practices, seniors can prevent common foot problems, reduce pain, and maintain mobility for years to come. Proper footwear. One of the best ways to prevent foot issues is by wearing the right shoes. Shoes that are too tight, too loose, or lack proper support can lead to bunions, corns, and chronic foot pain. Seniors should look for shoes with a wide toe box to prevent pressure on the toes, good arch support to reduce strain on the feet, cushioned soles to absorb impact while walking, a snug but comfortable fit to provide stability. Avoid high heels, narrow shoes, or footwear that lacks proper grip. If necessary, orthotic inserts or custom insoles can provide additional support and comfort. A good pair of shoes can make a world of difference in keeping feet healthy and pain-free. Regular foot inspections. Many serious foot problems start small and go unnoticed until they become painful. That's why it's crucial to inspect your feet daily. Look for redness or swelling, which could indicate infection, cuts, blisters, or sores, especially for those with diabetes, changes in toenails, such as thickening or discoloration. Using a mirror or asking a caregiver for help can make it easier to check hard-to-see areas. Catching problems early means they can be treated before they turn into something serious. Hygiene practices. Keeping feet clean and dry is essential for preventing infections. Seniors should wash feet daily with warm water and mild soap. Dry thoroughly, especially between the toes, to prevent fungal infections like athlete's foot. Moisturize the heels and soles to prevent dry, cracked skin, but avoid applying lotion between the toes as excess moisture can lead to fungal growth. Wear clean, moisture-wicking socks to keep feet dry throughout the day. Proper hygiene can prevent bacterial and fungal infections and keep feet soft, smooth, and healthy. Exercise and stretching. Just like the rest of the body, feet need regular movement to stay strong and flexible. Simple foot exercises can help improve blood circulation, reduce stiffness, and prevent pain. Some easy exercises include toe stretches. Stretch your toes by gently pulling them back for a few seconds. Ankle circles. Rotate your ankles to improve flexibility and prevent stiffness. Heel-to-toe walking. A great way to strengthen balance and coordination. Towel curls. Place a towel on the floor and use your toes to scrunch it up. This strengthens foot muscles. Just a few minutes of these exercises each day can improve mobility and reduce the risk of falls. By following these simple but powerful foot care practices, seniors can protect their feet, maintain independence, and continue walking comfortably for years to come. In the next section, we'll discuss when to seek professional help and why routine visits to a podiatrist are essential for long-term foot health. While daily foot care can go a long way in preventing problems, some issues require professional attention. Ignoring certain warning signs can lead to serious complications, especially for seniors. Knowing when to seek medical help can protect your feet and your overall health. Warning signs to watch for. If you experience any of the following symptoms, it's time to see a doctor or podiatrist. Persistent pain. If foot pain doesn't improve with rest, proper footwear, or basic home care, it may indicate an underlying issue like arthritis, nerve damage, or a stress fracture. Swelling or redness. Unexplained swelling, redness, or warmth in the feet could be a sign of infection, circulation issues, or even a blood clot. Open sores or wounds that don't heal. This is especially concerning for individuals with diabetes, as slow-healing wounds can lead to severe infections or ulcers. Numbness or tingling. A loss of sensation in the feet may indicate nerve damage, often caused by diabetes or other circulatory conditions. Changes in skin color or temperature. Cold, pale feet could signal poor circulation, while a sudden increase in temperature and redness might indicate an infection. Ingrown toenails or fungal infections. If left untreated, these can become painful and lead to further complications. The importance of regular checkups. Even if you don't have any immediate concerns, regular foot exams are essential. Seniors, especially those with diabetes, arthritis, or poor circulation, should schedule routine visits with a podiatrist at least once or twice a year. A podiatrist can identify potential problems early before they turn into serious conditions. Provide specialized treatment for chronic issues like bunions, corns, or plantar fasciitis. Recommend orthotics or footwear tailored to your foot structure and needs. Help prevent falls by addressing balance and mobility concerns. Your feet are your foundation. Taking care of them ensures a higher quality of life, greater independence, and continued mobility. Don't wait until a minor issue turns into a serious problem. Prioritize foot health, listen to your body, and seek professional care when needed. By following these guidelines, you can stay active, pain-free, and on your feet for years to come. Our feet do so much for us, yet they're often the most neglected part of our body, especially as we age. Taking care of them isn't just about comfort. It's about maintaining mobility, preventing pain, and protecting your overall health. Let's quickly recap what we've covered in this video. Common foot diseases. Conditions like bunions, corns, hammer toes, and plantar fasciitis can cause pain and limit mobility. Causes and risk factors. Aging, improper footwear, and lifestyle habits play a major role in foot health. Prevention and care tips. Choosing proper footwear, practicing good hygiene, and doing regular foot exercises can keep your feet strong and pain-free. When to seek professional help. Never ignore warning signs like persistent pain, swelling, or wounds that won't heal. Routine podiatrist visits can help catch problems early. Your feet carry you through life. Take care of them, and they'll take care of you. If you found this video helpful, please give it a thumbs up and share it with your loved ones. Let's help more seniors take control of their foot health and stay active for years to come. And if you haven't already, subscribe for more valuable health tips. Stay safe, stay strong, and take care of yourself, starting from the ground up.